Derek White video blog tutorial part 1. I would like for you to imagine you are a patient having a non-invasive procedure performed by an academic medical center, training hospital, teaching medical facility. The attending physician tells you that it is common practice to allow their residents and fellows to perform the procedure while they, as attending, simply instruct. Are you comfortable with allowing a resident or fellow to perform the procedure opposed to the attending physician who has 25 years of experience performing these procedures? If you are not comfortable with allowing the resident or fellow to perform the procedure and you make this clear and well known to your attending physician and they proceed to tell you that it's a teaching medical facility and the resident/fellow will be performing the procedure despite your feelings, would this be considered a legal issue for the medical facility? If so, what category would this fall under legally? First and foremost, hypothetically speaking, if I were a patient and it was a non-invasive procedure, I personally would not have a problem with a student or a fellow getting the experience that they need in order to become a licensed physician. However, I would understand if someone would like the attendant to perform a specific procedure. However, a patient does have the right to decline the procedure if they would like the attendant to perform the procedure. And there are a list of a patient's Bill of Rights, and I believe it would fall under right to choose alternative treatment options if available. Patients have a right to consider treatment alternatives and even refuse treatment. There are a list of rights that a patient has, starting with right to information, right to records and reports, right to emergency care, right to informed consent, right to confidentiality, human dignity and privacy, right to second opinion, right to transparency in rates and care according to prescribed rates wherever relevant, right to non-discrimination, right to safety and quality care according to standards, right to choose alternative treatment options if available, which I think it would fall under, definitely could be wrong, right to choose source for obtaining medicines or tests, right to proper referral and transfer, which is free from perverse commercial influences, right to protection for patients involved in clinical trials, right to protection of participants involved in biomedical and health research, right to discharge of patient or receive body of deceased from hospital, right to patient education, right to be heard and seek redressal. Now, by it being personal opinion, by it being non-invasive, I definitely wouldn't have a problem with that. If you're talking in regards of something as a ultrasound, something of that nature, checking my blood pressure, that is considered a procedure. So I definitely wouldn't have a problem with that. However, I did have the simplest invasive procedure, because I've had some surgeries. The simplest, I would say, they went up my nasal cavity with a camera, and I let a student do that, and I regret that. But however, something non-invasive, I wouldn't have a problem with that.